Okay, let's discuss the perimetry. So today's video is based on basically the difference between static and kinetic perimetry, and definitely I'm going to make the video on the visual field, and definitely both things goes together. And let me know clearly that I'll explain as far as I possible, as far as my uh, horizontal of knowledge expands. Okay, just not try to be everything I know, but I try to explain everything I know, but I don't know how much I can make it. Okay, let's move forward. So, what is perimetry? See, it's a subjective examination. Just understand this. It's not an objective examination. Okay. Yes, there are some methods, but not this is subjective examination. Subjective response matters. And what do we do? And so the method for estimating the extent of visual field. Okay. So basically, perimetry is the subjective examination method for estimation extent of visual field, and what it enables us to assessment the visual function throughout the visual field. Okay, another thing, detect and quantify the damage of the visual field. It's very important, damage of the visual field. And another thing, monitoring over the time. It really helps. The one time how it goes and certain time moves how it goes, isn't it? That's what, for example, glaucoma. It's a disease that progressively damaging the visual field, isn't it? So, perimetry is a standard clinical perimetry test, distribution of the light difference sensitivity of visual field. So, basically, what is the principle of perimetry? This is the line, okay? Light difference sensitivity in the visual field. What do you mean by that? The sensitivity reflects the capability of the eye that perceives the brightness difference between the target and its bright background. Central important. So, what is the difference between brightness of a target, what we have shown to the patient, and its background, basically? So that's why difference light sensitivity. This formula always comes. Okay, L1 divided by L2 minus L1. L1 is a background luminance. L2 is a target luminance. That's why background luminance is above and the target luminance minus background luminance. That's the uh, differential light sensitivity. That's very important. It's a very principle of the perimetry, no matter what perimetry, but it's important. Okay, so normally let's talk about visual field, but I'll definitely go move into it very deeply in our next videos. The visual field is defined as the area that eye perceives simultaneously by fixating eye. It's not about eye moving. It's about fixating eye at something and simultaneously how much area in the visual field you can cover. That's a totally called visual field. Okay, so normally superior is 60 degrees, inferior is 75 degrees, temporally the highest 100 degrees, and nasal is 60 degrees. And it's depend upon the how your cheekbone is high, your eyes shrunken deeply or not, your nose size, and there are a lot of things that matters. Okay, so another thing that matters is binocular field of view. This is the binocular field of view. In each eye has the monocular field of view, the right temporal monocular and left temporal monocular field of view. A central important, how long the binocular field of view? Approximately 120 degrees horizontally, and vertically approximately 60-70 degrees, isn't it? And we know it, is it? Inferior field of view belongs to superior retina, superior field of view belongs to inferior retina, temporal field of view belongs to nasal retina, nasal field of view belongs to temporal retina. I think you are always already clear about it. So trackware define the visual field is an island of the vision in the sea of darkness, because you see something around here and you don't see along, neither temporally nor nasal. You see only island of the vision. So here of 3D representation of the retinal light sensitivity. C represents the area of no light, because here you can see there is no light in black portion, only light in the white portion, and there is still black portion that is in the visual, which is belong to blind spot. So under photopic condition, the shape of the hill of vision is closely related to pack density of the cone and receptive field size, isn't it? This peak comes to fovea because there is the highest pack density. So before moving on to depth into the perimetry, we have to know few terminologies. What are the terminologies? What is luminance? I have already covered in my previous videos in photometry. Luminance is the intensity or brightness of the light stimulus measured in apostable. It's inverse to sensitivity. Higher the luminance, The lesser the sensitivity, lower the luminance that can detect, higher the sensitivity. Just remember apostable term. Okay, isopters, that's very important term. All the location where the stimulus is first seen have equal sensitivity, and these locations can be connected to one another and form a ring shape around the locus of the point, and that ring shape that's called isopter. Okay, in this presentation, see this black ring has equal sensitivity around it. For example, this ring has equal sensitivity in all the point, and that's what we call isopters. So now threshold, I'll again move to threshold uh, again and again, but just remember one thing. What is threshold? Threshold is the minimum light of necessary to evoke the visual response with a probability of 0.5. It's very important. It's not the minimum light of energy that necessary to evoke visual response. That's not. But with the probability, that's obviously one answer, but you have to add with the probability. See, what's myopia? Myopia means whenever light comes from infinity, it focuses in front of the eye, in front of the retina. But you have to add when accommodation is rest. That's the correct definition of myopia, isn't it? If you don't add when accommodation is at rest, then your definition of myopia will not be accurate as possible. That's the same thing here. The minimum light energy necessary to evoke the visual response with the probability of 0.5. That is, the observer can detect stimulus 50% of time it is presented. So it's not about just to see the light. It's about seeing 50% of the time present the same light at same location. Okay, sensitivity which is reciprocal to threshold, isn't it? So higher the threshold, lower the sensitivity. So sensitivity is represented in the decibels. It's very important, not in apostable. Okay, decibel is basically, it's not that easy thing. Decibel is actually ratio thing. Decibel is not the absolute thing. See, 0 decibel means 1000 apostable, then 10 decibels mean you divide by that, 1000 divided by 10, and then again 20 decibel means, what is this, 100, and then 40 decibels means 1, 50 decibels means 0.1. Whenever you add 10 decibels, you divide by 10, isn't it? So higher the decibel, lower the intensity. It means higher the retinal sensitivity. Lower the decibel, higher the intensity, which means lower the retinal sensitivity. It's very important to understand. We use decibels, not apostables, because if you use apostable, you have to write it a long words. Like for example, it's 1000, and it is exactly opposite. Higher the apostable means lower the sensitivity. So that's very important. Whenever we see decibels, we directly can correlate the higher the decibels, higher the sensitivity. That's why we use decibels, and around region we don't have to use that 4 5 digit words. Okay, another word is anopsia. Anopia means basically defect in the visual field. Simple. For example, hemianopia, half of the anopia. And then we come to know absolute scotoma and relative scotoma. That's very important. Absolute scotoma is an area of total absolute loss of vision with the surrounding seeing area. That's called, this is absolute. You cannot see here, but at the same time you can see here. But relative sensitivity is not that. It's just a reduction of sensitivity around the seeing vision, that you cannot see here. No, that's not. You see here in the center, but there is a reduction of sensitivity in the center. Okay, that's called relative scotoma. So what is the difference between kinetic and versus uh, static perimetry? See, kinetic perimetry, it's very important to understand that stimulus size and intensity is same, but what's the difference? We move stimulus from non-seeing area of the visual field to seeing area. That's kinetic. Kinetic means the movement, and along the set of meridian to determine the extent of visual field and visual field defect. That's how in that meridian where we move that kinetic perimetry light, we want to see is there is defect or not. So the procedure is repeated with the use of same stimulus along the meridian, usually spaced 15 degree, to plot the isopters. You know isopters from the earlier. Okay. The heel of the vision is found by approaching horizontally from non-seeing area to seeing area. Example: Goldman perimetry and arc perimetry, isn't it? So This is the principle, differential light sensitivity, isopters as we have discussed. But what we will do, we come from non-seeing area to seeing area. Our stimulus is fixed size and fixed intensity, and we move from non-seeing area to seeing area horizontally approximately 15 degrees space, isn't it? So static perimetry, now it's different. Now static means it's stationary. We do not move stimulus from non-seeing to seeing. Okay, the size and the location of the target remain constant. Here's also the location constant, size constant, yes, in both cases, but location constant, that's important. Location is constant, remain constant, and measurement of threshold at that point. Particular point, we measure the threshold by remaining size and location at the same time. But the threshold is determined exactly by increasing the luminance of the infrathreshold target as well as decreasing the luminance of the suprathreshold target until the threshold has been determined. It's definitely depend upon how we are going to examine threshold. There are different techniques of examining threshold. We will definitely going to talk about in these techniques in Humphrey visual field. But till now, it's about detecting threshold by putting first infrathreshold, then increasing light, or putting highest light and decreasing light intensity. Oh, no matter what, that's a different technique like staircase technique, suprathreshold technique, infrathreshold. There are other things. We will talk about them later on. So in this case, position is same. Whether we decrease the light intensity or increase the light intensity, it's depend upon the way, and it's a two-dimensional plot. But yes, definitely we can think it about in three-dimensional plot too. But let it be. So comparison between kinetic and static perimetry, the principal difference is the way of detecting the differential light sensitivity, because this is the principle of perimetry. So basic difference is the way we detect the DLS, isn't it? The kinetic examination with a moving test object allow to detect the steep gradient or circumscribe the scotoma especially well. So basically, we determine steep gradients defects. But in case of static perimetry, where the test target is stationary, the method is specially suited for the defect field with a flat gradient. I'll tell you what is steep gradient and what is flat gradient. Example circumstances flat scotomas or generalized depression in differential light sensitivity. Okay, so this is it. See, in case of differential light sensitivity and eccentricity, when we move light, it's way easier to detect in this condition, whereas the defect is steeper, it's focal. But at the same time, if we throw light directly at the point, we're not moving it's far easier to detect small depressions too. Okay, small slopey difference, not steep difference. We don't. Sometimes in case of kinetic perimeter, we can miss the slope or shallow depression in the visual, shallow defect in the visual field. But the above is actually visual field, kinetic visual field, and this below this is static visual field. Okay, you can see this diagram and understand how these things work. Okay, with continuing test, if we find the steep slope visual field, kinetic principle with a horizontal motion toward the hills or towards the margin of scutoma will provide much sharper and well-defined threshold than vertical approach. So it's very important. If you have steep slope of the visual field, there is a particular defect in the visual field, then kinetic would be better. But if slope is flat, if there is only slight inclined horizontal gradient, means if there is slight defect, then static method of a vertical approach is superior than the kinetic method. It's very important. And again, the physiological distribution of differential light sensitivity with relatively flat slope in the paracentral areas and in mid-peripheral make the static principle for the central visual field method of choice. Because if there is a slope that is flat, not that deep, then we definitely choose a static method. And similarly, steep gradient in the peripheral field of visual field defect, then we make kinetic principle superior than one. It's better. You always understand if there is an steep gradient, steep defect, or if there is shallow or slopy gradient. At that particular point, slopy, then we choose static. If there is steep gradient, that is defect in the peripheral, especially peripheral, field, we choose uh, Kinetic. Okay. So basic difference between static and perimetry and kinetic perimetry. Kinetic perimetry measures the extent of visual field by plotting isopters. Isopters are very important in case of kinetic visual field. But static measurement of sensitivity each retinal points. In case of kinetic, we move from non-sync to sync. In case of static, we see every point in the visual field. Okay. So stimulus move from non-sync to sync area. In case of kinetic, stimulus is stationary, but we increase luminance until seen or until unseen. It depends upon the threshold measurement techniques. So stimulus size can be varied and constant. We cannot say that. We can vary in both conditions, but yes, definitely to draw different isotopes, we will definitely change the stimulus size in case of kinetic perimetry, for example, Goldman perimetry, but it remains constant approximately all the time in static perimetry. It's not that we cannot change, but we will definitely change if we need, but we choose not to change until and unless needed. Okay, so it's called 2D measurement of the hill of vision and 3D assessment of the field of predetermined area field of vision. Or sometimes, but not. We can also think about it in case of 3D, but in kinetic perimetry. But let's till now take it slightly as kinetic as 2D and static as 3D. Okay. So kinetic perimetry results depend on the experience of operator. It's very important in case of kinetic. For example, Goldman perimetry. It's very important. The examiner's experience. But static perimetry, like for example, automated perimetry by Humphrey and all these things, it depend. Though it depends on the experience, but it's very little role of the operator. Okay. Kinetic measurement can be rapidly evaluated peripheral visual field. That's why we always use in case of neurological defect kinetic perimetry, especially if we want to plot out the periphery of the visual field and plot defect, deep defect, because deep defect it's easier to detect by kinetic perimetry. Can accurately plot steep borders defect and useful for the localization and characterization of neurological defects. So for neurological defects, we use kinetic perimetry. Though in recent years we use static perimetry, especially Humphrey perimetry in case of neurological defect. Yes, but yes, Goldman perimetry is still used. It has been for static perimetry, it has been the ability to detect scotomas, particularly small, shallow, and fluctuating scotomas, but cannot correctly outline the border of the defect. It's very important. To outline the border of the defect, it's better kinetic, but border should be sharp defect. So example of kinetic perimetry is confrontation perimetry, which is very important. We will going to definitely going to delve into it. Tangential and arc perimetry, but yes, I'm going to make good presentation on Goldman perimetry. And static perimetry, automated perimetry, especially Humphrey is gold standard currently. And from Goldman perimetry too, we can do static perimetry, but not that much, that often. But automated perimetry, in case of Humphrey perimetry, I am definitely going to delve into it and about uh, 10 or 12 presentations. Okay. So finally, the moving stimulus will be detected more readily in the periphery than the static stimulus because of the succession of lateral spatial summation. You know lateral spatial summation, isn't it? From visual field, because in the periphery there are large uh, cells. These cells connect to each other to single ganglion cells, and this all causes what? Lateral summation of stimulus, isn't it? That's why peripheral visual field comes to magno pathway. So as the stimulus moves across the visual field, the spatial summation of the receptive field adjacent to the receptive field over which the stimulus is placed occur. Thus, the detection of the stimulus will influence normal area visual field, in addition to any damaged area, which could lead to shallow focal loss of the visual field being missed. That's why, because of the lateral summation, spatial summation in the periphery, so shallow focal loss of visual field in the periphery, it often missed by kinetic perimetry. Okay, so that's why if you need shallow, if you want to detect the shallow focal loss, static perimetry is always best. That's why in case of glaucomatous field defect, we never, almost never use Goldman perimetry. We always focus on the static perimetry, especially Humphrey perimetry, isn't it? So you have to understand what is the lateral spatial summation. It's very important, and that's why visual perception book is very important. Okay. So finally, I just come to rest here because I don't want to bother you and make this video like 1 hour. I'm making everything. I know I have to make like 18, 19 videos to make it clear the visual field, and I'm going to do it. Till now, this is my reference, and very good books. Every books are very good, and especially this book. It's very good by J.R. Reddy. It's very good. And second, this book is ultimate best books that I can recommend. Okay, Bistan, choose.